Good morning, everyone. Hi, I am Dr. Pratima, Manager in Training in Solutions 3X. I'm going to take this demo session. So, coming to the medical coding. So, in general, some of you or all of you must have done the research, right? What is medical coding? What are you actually looking into? Medical coding is nothing but we are transferring all the medical record which contains your diagnosis, treatment, and the services, all those into universal set of alphanumeric codes. Okay. So these codes will be in different modules. We'll see all those with the session. Okay. Yeah. So here, before we go into the demo session, I would like to introduce our leadership board of Solutions 3X who built this Solutions 3X. Mr. Sami Mohammed and Muthu Gandhi came up with the idea of giving quality education to the students who are looking into the aspiring career of their career into the medical coding in the healthcare industry. Mr. Muthu Gandhi is our CEO and he has 20 plus years of experience in coding operations. He worked as a senior director in Omega Ethos. Sami Mohammed is our COO. He has 21 plus years of experience in HR and training. He worked as a senior director in Apollo Health Antilio. Shali Ramprasad is our CEO. She's heading our operations from the North America. She has 20 plus years of experience in RCM and CDI operations. She worked as a senior director in Ethos Sintel. Mr. Raja Gumadi is the director of training and he has 15 plus years of experience in coding operations. He worked as a senior manager in GAPS Antilio. Harini Durbaka is our associate director. She has 15 plus years of experience in billing operations. She worked as a senior manager in Optum Genpact. I am Dr. Pratima. I'm manager in training here. I have 12 plus years of experience in clinical operations and I worked as a clinical investigator in Optum. I'm a homeopath by profession. So we all together and we have a very good team of training department which will be helping you in the training part, teaching you all the guidelines and giving you the heads up with the coding guidelines and also that you give the accurate and the correct code. Yeah. So this is Solutions 3X and coming to the medical coding part, right? US healthcare, as you know, is a vast growing industry nowadays, right? So we have n number of opportunities. Now we are we are working for the US healthcare only. We get the medical records from the US healthcare and we will be giving the codes, okay? So all this will be falling into the RCM cycle. RCM means revenue cycle management. In this RCM cycle, when we are getting the records, we call it as the encounter. These records come to us for the medical coding. In this medical coding, we do convert the entire medical record. When you see a medical record, right, you will be having the diagnosis. The patient goes to the hospital and he describes his symptoms and whatever he's having in his own language. Yeah. Now your doctor, okay, we call them as the physician there or the healthcare provider. He writes it in the medical terminology. Okay. For all the symptoms and all, he does some examinations and tests and he finally gives a diagnosis. Yeah. For this diagnosis, he will be planning the treatment, what type of treatment he's going to do, be it a surgical treatment or a therapeutic treatment or a radiological treatment or a pathological treatment, anything. He will be planning that one. He will proceed with that treatment, right? After that, for that treatment, usually during the treatment or after the treatment, sometimes they have to provide some equipment or supplies to the patient, okay? Like say suppose after the fracture surgery or anything, they are providing a orthotic boot or they are providing a wheelchair, okay, or they are providing some catheter injections, anything like that. All these come under the supplies. So when I see my entire medical record, I will have the signs and symptoms with a diagnosis, with or without diagnosis. I'll have a diagnosis, then I'll have the treatment, what they are doing for that diagnosis, and I'll have a supplies also, okay, sometimes if they are giving. So all these will be there in the medical record. I am converting these into the universal set of alphanumeric codes. Okay. These alphanumeric codes will help us for the billing purpose. Okay. We are giving the correct and the complete code which helps in the billing purpose. So there the pricing and everything will happen for that procedure or anything or the treatment and all. And then it will go to the AR follow-up. AR follow-up means account receivable follow-up, right? Then they will go with the payment to that physician or to that hospital. Yeah. So all these together, all these encounters together is called the RCM cycle, revenue cycle management. As you can see in this cycle, ours is the first step. Yeah. Medical coding is the first step. So we have different modules from which we have to convert the medical record into the universal set of alphanumeric codes. Okay. To convert this, first we should understand the human anatomy, right? So we should understand which part they are talking about, what is that region or the organ or the structure and all they are saying. Okay. After that, we should know as the healthcare providers or the physicians, as I told you, the doctors, right? The doctors, whatever language they are using, right, for the diagnosis or the procedures, these are called the medical terminology. Okay. Medical terminology is the language used by the healthcare professionals. Okay. So I should understand as a coder, first I should understand the anatomy, then I should understand the terminology, and then I should go with these three modules. Okay, to understand with the guidelines and give the correct code. So in our training, though you are from the science background or the non-science background, we do a training of the anatomy, the overview of the anatomy, and then we'll go with the terminology, and then we will go with these three modules. Okay, wherein you will go with the codes for the diagnosis, treatment, and the supplies. Now, these three modules are there. The first module is ICD-10-CM. ICD-10-CM means International Classification of Diseases. ICD, International Classification of Diseases. We are following the 10th revision. Sorry. Yeah, we are following the 10th revision and it is a clinical modification. Okay. From this module, we are going to give the codes for the diagnosis or the diseases or the conditions, which is like written in my medical documentation, right? So I will pick the term, I will go into this module, and these codes are alphanumeric codes, okay? There are n number of guidelines and conventions here, which will be like taught in your training. Following all those conventions, I will give the correct and the complete code. Okay. Now, I gave the code for the diagnosis from ICD, International Classification of Diseases, right? After that, for that diagnosis, whatever the treatment the doctor is doing, the physician is doing, that treatment codes will be in my CPT module. CPT means current procedural terminology. Okay, current procedural terminology. These are a 5-digit codes which I have to give. Again, I have some guidelines and rules to be like followed to give the correct code. I'll check all those. I'll check my documentation and I will go give the correct code. Okay. Now, the other module is HCPCS. HCPCS means Healthcare Common Procedural Coding System. Healthcare Common Procedural Coding System. From this module, I'm going to give the codes for the supplies or the equipment, okay, whatever they are using during or after the operation or the treatment to the patient, okay. If those are documented in my record, I should go into this module. These are the 5 alphanumeric codes, okay. So these things I have to give. So whatever is there in my medical documentation or the record, I am converting everything into these codes, right? So I can see most of them are joining still. Okay. Yeah. So got it. Again, I'm saying you, anyone, any difficulty in understanding English means do let me know, guys. I am comfortable in like explaining in Hindi and Telugu. So you can ask me if you find a difficulty in understanding. Okay. Now, for those who have joined now, yeah. Okay. Yeah, for those who have joined now, I'm again saying medical coding is nothing but we are converting the medical records which we get from the US healthcare providers into universal set of alphanumeric codes. These set of codes will be in these three modules, ICD, CPT, and HCPCS. Okay. When you see a medical record, you will have the signs and symptoms with a diagnosis and the treatment for that diagnosis. And if they are using any type of supplies or equipment during or after the operation or the treatment, all those will be like written in the your medical documentation or the record. So as a coder, we are going to convert those terms. The medical terminology will be there, which will be like taught to you in the first few days. With those, I'm going to go with the codes from these three modules. In this ICD 10 ICD means International Classification of Diseases. We are
That
following the 10th revision. Yeah, Sharfodin.
sorry, ma'am.
Okay. Yeah. So here from the ICD, International Classification of Diseases, we are going to give the codes for the diagnosis or the diseases or the conditions written in the medical document. Okay. These are an alphanumeric codes. Okay. A seven like a character alphanumeric codes. We have n number of guidelines for those to give like the complete code. We'll follow those guidelines and give the code. Then for the diagnosis, whatever the treatment the provider means your doctor did, for that procedure or the treatment, we give the codes from the CPT. CPT means current procedural terminology. These are 5-digit codes, which I will be like checking my documentation, what treatment they did, and I'll pick the code from this module. Okay. So the other module is HCPCS. HCPCS means Healthcare Common Procedural Coding System. For the treatment, during or after the treatment to the patient, if the doctor, the provider is giving any kind of equipment or a supply, like wheelchair or orthotic boots or beds or anything like that, those supplies I will code from this Healthcare Common Procedural Coding System module, which has a 5 alphanumeric codes. Okay. So I have everywhere, I have some guidelines and rules to be like followed to give the complete and the correct code. Okay. Now this complete and the correct code will help in the billing part. Okay. So whatever we code will go into the billing and then it will go into the AR follow-up and then the provider, the physician or the facility. Facility means the hospital, guys. So they will be like receiving the payment. Okay.
Ma'am,
So
what is I are following what is meaning?
yeah,
Are following what is meaning?
AR.
AR.
AR means accounts receivable follow up. Okay. They do the follow up to know to work. They work with the insurance and the your provider or the facility, the hospital. So the correct and the complete payment is going to them.
Complete payment.
Yeah.
Thank you.
Okay.
Completely.
They work with the payment part. Our
Given.
part is the medical coding part. Our part is the first part.
First one medical code and then medical billing second part.
Yeah. So we as a coder, we give the medical codes. We should give the correct codes so the correct payment goes to the physician, the doctor or the facility, means your hospital. Okay. Yeah. So that is the thing. Now, before we go into the types of coding, I will ask you, I explained it twice. So let me ask you a question here. Okay. And we'll check the ICD book also once, how it looks like and all. Okay. So this is your question. I want everyone to answer. Okay. You can type in the chat box or you can unmute and answer me. Here, this is a part of your medical record, guys. Julia tripped and fell down 3 stairs in her apartment. X-rays show a fracture of the metatarsal bone of her left great toe. Okay. Treatment is the physician does closed treatment of the fracture with special orthotic boot. Now from this record, can you give me what is the diagnosis here? What could be my ICD?
Meta metatarsal bone.
Metatarsal fracture.
Yes.
Right? So
Yes.
this is my ICD. Yes. Yes, Siddhu. Wonderful. So this will be my ICD, right?
Yes, ma'am.
So I'll go into the ICD module. Yes, everyone is giving the right answers. Yes, awesome. So fracture, right? Now I'll show you the ICD module here, how the book looks like. So your ICD will be like this, with all the codes and everything with the diagnosis and all. So the diagnosis or the condition I'll pick from here, from this book. Okay. We'll provide you the books, guys. So here we'll scroll down with the term fracture because she fell, it is a trauma. And I will go with the term metatarsal in the alphabetical order. I will check for the metatarsal bone and they said the first one, right? Okay. So I will go, I got the code here, S92.31. Yeah. As you can see here, it is giving me S92.31. Okay. And this is not my complete code. There are some guidelines and everything which I have to follow. And this I will pick and I'll go into the other part of the module wherein I will understand the guidelines and all. And then I will complete the code. Okay. So your code will be like this, S92.35, and it will be an extension because I said it is a 7-character code. Okay. It may have 7 characters or it may end with 3 characters only. Okay. It depends upon the condition or the guideline in the coding part. So this is your ICD. Now, coming back to the question, here as you can see, this is my ICD. I got the condition, the diagnosis, I'm giving the code. Now, what will be my CPT? Current procedural terminology, what will I give that one?
Physician closed treatment of the fracture. Special
Yes,
orthopedic.
wonderful. Closed treatment of the fracture will be my CPT, right? I'll
Yes.
pick this one. I'll go into my CPT module. With the system wise, I have some guidelines and all. They are a 5-digit code I should give with the guidelines and everything. Okay. Now, what is the supply here they are giving for the patient? What is the HCPCS?
Orthopedic boot, ma'am. Orthopedic boot.
Orthotic board, right? Yeah,
Yes.
this is your supply. So this one, I will pick from this, the record, and I will go into the HCPCS module and I'll give the code. Okay, they are an alpha numeric code with 5. Yes, Afrin. Yes, Anjana. Yeah, everyone understood, guys. So this is how, this is a simple part of the record. So we will learn how to read the record and what to understand when they're talking about the metatarsal, right? Whoever is from the non-life science background or whoever, even for the life science, it will be a brush up for the life science. For the non-life science, it will be a learning. Learning the anatomy. Anatomy is nothing but us. We are learning about ourselves and we will learn the medical terminology, which is the language, okay, used by the physicians, the healthcare providers. That one we will learn, and then we will understand the record. We'll go into these modules and give the codes. Okay. So any doubts here? Hope everyone understood, right? Okay. I'll take it an S. Yeah. So coming to the types of medical coding. There are 3 types of medical coding usually. And here one is the physician coding. Yeah, thank you. So here physician coding means physician, I told you, he's the doctor, right? So when we are coding for the physician, he works, we are doing a professional coding. We are coding for the professional. So it is called the professional coding. And when a physician is working in a clinic, emergency room, or radiology department, pathology department, like that, we are coding for that physician. Okay. The other one is the hospital coding. Hospital means the facility, I told you, right? When you go to the hospital, you see different departments there. OP department, IP department, the surgical departments, different departments will be there, right? So when you're coding for the departments and all, then it will be the facility coding or the hospital coding. The other one is the payer coding. On the payer side, means on the insurance side, on the claim side, when you're giving the codes and all, that is a kind of risk adjustment or the auditing coding and all, that will be the payer coding. These are the 3 types of coding. For these 3 types of coding, the highly preferred certifications are CPC and CCS. CPC means code certified professional coder, and CCS means certified coding specialist. Okay. These 2 are highly preferred certifications provided by the US organizations only for us to go with the further of our like the career planning and our growth and everything. Okay. Now, they are the types of coding. Now, as I said, there are different types of coding. Those 3 for that, you have the specialities. Okay. You start off with the less complex as a fresher, or okay. And you go with when it is the less complex, it is a type of your outpatient visits or your radiology department, pathology department, anything like that. You're coding for a particular department. Okay. When you want to like upskill yourself and go into a little complex one, then you can go with the emergency department, general medicine, all those things. A little more complex, you want to upskill yourself and go with a little more complex, then you can enter into the same day surgeries, like your endoscopies or the simple surgeries, minor surgeries and all. Then you want to go with a high complex, okay, you want to do more and more, okay, you want to learn more, then you can enter into the IPDRG. IPDRG means inpatient diagnosis related groups, wherein we are coding for the inpatient services, the surgeries, the vascular surgeries, neurosurgeries, or anything, right? So those will be like coding. So this is how the complexity will be there. Everywhere you have to like upskill yourself, you should learn more, and you will be like going into the greater complexities. Yeah. So these are the things, the types of coding and the the specialities in the coding part. Now, once we are learning that, we know like in our mind we'll get like what is my growth in the medical coding. Okay. So you start off as a coder, as a fresher, whatever be your educational background, whatever is your age, companies may or may not ask that one. Okay. Most of the companies do not check with the age, guys. They go with the certification. With or without certification, you'll get the jobs. Okay. So you start off as a coder. Here we are giving you the ranges of the salary and the years of experience. Okay. These will be like changing depending upon the company you are working for. Okay. Upon the project, upon the company and everything. You start as a coder, you grow as an auditor. Okay. And then you can become an SME. SME means subject matter expert. Then you become a project leader, team leader, manager. Okay. So when you see your growth, it is like a pyramid. Okay. You're growing forward only, no looking back. So you learn, you upskill yourself, you prove yourself, do the correct and the errorless coding. You'll become like this. You'll be like growing eventually. Okay. So that is the growth. Now for this one, where should I start with? Right. The next question is like, how should I start? Where should I start? And what should I do to become a topper, to become a coder, the best coder and all? So where to start with? You start with the basic medical coding training. Okay. Check with your the training institute or the organization whether they have the credentials like AHIMA and AAPC, and the trainers, how are the trainers, the professional, and how they are like training and everything. they have any like type of the credentials, okay, the certifications and all those you can check. And then you go with the training. Once the training is done, plan for the certifications, okay. The certifications I told you, CPC and CCS, okay. These certifications of medical coding are provided by the US healthcare organizations, AAPC and AHIMA, okay. These two organizations in the US provide the certifications, guys. AAPC means American Academy of Professional Coders, which provides you the certification of CPC, Certified Professional Coder, and AHIMA means American Health Information Management Association. This provides you the certification of CCS, Certified Coding Specialist. Okay, these two are highly preferred certifications throughout. And in India, Solutions 3x is the only organization which is approved and affiliated by both these organizations of the US, AAPC and AHIMA. So because we are directly affiliated with them, approved by them, we provide student discounts to our students of Solutions 3x who are planning for the certification. Okay. The certification fee you pay directly to the organizations only. As we are affiliated with them, we provide the student discounts. So CPC, you have the market fee as a 67. Solutions 3x will be like providing at 355 for the Solutions 3x students only. Once the training is done, you can plan for your certifications. CCS, 2 items we have like for the 38,000. You can check this one, compare it with the market rate, and you can go ahead. Yeah. So those will be like done once your training is done. So coming to your training part, in Solutions 3x, let's look at the pattern. How do we train our students? So our training will be for 2 months of duration and an extra of a couple of weeks or 15 days, which we will be like concentrating on the certification exams. Okay. So here in these 2 months of duration, we have the online sessions and the offline sessions. We are Hyderabad, Telangana based. We have our organizations branches in Amirpet and in High Tech City. 2 branches are there. You can come anywhere for the offline classes. You can plan accordingly. And online sessions also will be like going on. We have all the professional trainers training you with all the modules. Okay. And every day, every session, Monday to Friday will be the classes, and every day 2 hours per session will be the classes. And these 2 hours will be a live interaction with your trainer only. Okay. So be it online or offline. Online also we provide the live interaction class, and it is not a recorded class, guys. You have the direct like interaction with your trainer, like how we are doing now. And those will be like recording all the live classes. We provide you an LMS app. LMS app means a learning app by the Solutions 3x. We provide that one. Into that app, we provide all these classroom recordings, the live class recordings, be it the offline or the online. The classroom recordings daily, it will be like uploaded. Okay. So Monday to Friday, 2 hours per session. Now on Saturday, we take the assessments. Okay. We provide you the test into your apps only. You should go with the online app and you should go with the test. And whatever you have studied in the 5 days, that test will be like provided. You have any doubts in your assessment, you can like ask your questions to your trainer. They will explain you. Otherwise, they'll go ahead with the next lecture. So that is the thing. And coming to the modules, right? As I told you, first we are going to teach you the anatomy and physiology and the medical terminology. Then we will go with the ICD-10 guidelines, how to give the correct code. Okay. And we go with the CPT or your PCS, depending upon the type of certification you're going to choose, CPC or CCS. Your modules will be like changing here. PCS coding also will come for your CCS certification. So we'll go with that one. And the HCPCS compliance. Compliance means the regulations followed by in the US healthcare. Okay. So these things will be like taught, and every week you'll be like having the weekend exams, the assessments and all. And after that, after your training is done, we provide you the certification preparation. Okay. This certification preparation in your apps will be like providing you the mock test. These mock tests are nothing but a replicate of your certification exam. How to take the exam, how to do the time management and all will teach you. Okay. We also do the virtual lab practice. Once the training is done, depending upon the number and the interest of the students, as I said, like we are Hyderabad placed in High Tech City and Amirpet, we have the branches. We do the virtual lab practice also, wherein we give the sample records to the students so that they have the hands-on experience to go and give the codes. Okay, how does the record looks like? What do I check? What? How do I give the codes and all? And at the end of the session also, we'll provide the interview preparation. Once the training is done, we provide the interview preparation wherein we groom our students, like how to like go for the interview, how to crack the interview, how to present yourself and answer and like enter into the healthcare industry. Yeah. And it is you who has to go with the confidence and crack the interview. Yeah. So these are the things, and the exam registration you'll be like doing to the US organizations only, AHIMA or the AAPC for the certifications, and we provide the discounts. Okay. So that is a 2 months of course with an extended period of 15 days for the certification program. And for this program, we are going to provide you the LMS app I told you. In that LMS app, you will be like provided with the live class sessions. Okay, the recordings will be there. The study material will be there. Practice questions will be there. Weekend assessments and also at the end mock test. Okay, all the interactive learnings, everything will be there into the apps. And we also provide the copies of the code books. Okay, the ICD, CPT, HICPICS and all. So those things will be with you. And as I told you, before only I told you, right? I would like the interaction section and all. The same thing we encourage our students to interact in the classroom as if you have any doubts regarding the medical coding, okay, you can ask your trainer. You didn't understand in English, you can ask them like to provide that clarification in Telugu or Hindi. They are good at that. They will explain you. Even then you have some doubts, you want to spend like time with the doubt clearance and all, depending upon your trainer's timing before or after the class, they will work with you for 5 to 10 minutes. Okay, so these are the things. Virtual lab I told you we have it in High Tech City and Amirpet. Depending upon the number and the interest in the students after the course, we provide that. We also do an internship program depending again on the numbers and the necessity. And Solutions 3x, we have our own project, a radiology project we have. And lucky you, if we have like the necessity or anything, we can grab you inside, depending upon your discipline, on your performance in the classroom hours and in the assessments and all. Okay, so these are the things. And certification preparation, I told you, we'll give the mock test and we do clear the doubts and discuss everything. And interview preparation, we help you with the resume writing. Our leaders will talk to you on the job assistance. We have a good connect in the RCM organizations throughout India. So whenever we get the job post from the RCM organizations, we prep our students and send there. And it is you who has to go with confidence and crack the interview. Okay. So job assistance will be like provided, and you can go ahead with the resume writing, and mock interviews also will do, like what do they ask, how do you should like present yourself, all this grooming will do. Okay, so these are the things. And advanced level, if you want to like go into IPDRG, you want to do like some kind of ED department training and all, we provide those also. Okay, so discounts I showed you on the exams, what we are providing to our students. So RCM organizations, there are n number of organizations, and Solutions 3x is tied up with all the some of the organizations, actually most of the organizations. So whatever we get the job post, we prepare our students and send them there. Okay, so these are the things we do at Solutions 3x. And yeah, before we go ahead, I told you, right, the job post we get and we post them, we prep them, we prep you, and we'll be like sending you for the job interviews. Okay, these are the things. And yeah, before we go ahead, do check us on Google, YouTube, Facebook, Instagram, LinkedIn, everywhere. You can check us. And yeah, here let me like give a student testimonial about us.
They trained me in such a way that I have cleared my CPC certification with 95 percentage. Hello everyone, this is Neha from Varangal. So by profession I'm a dentist from India. So after marriage I've moved to US. Here in US I started my career as a dental assistant. While exploring AAPC website and other online resources, I got to know about Solutions 3x. So duration of the training period is for about 3 months, where we have dedicated instructors who provide assistance in regard to subject at any time. Either it may be during training hours or non-training hours also. Coursework is designed in such a way that it helps anyone to master with the subject with or without any medical background. So after the completion of the course, we had a good number of mock tests which helped me to understand the exam pattern clearly before my actual attempt. And so that's why I would highly recommend you to opt for Solutions 3x.
So this is one of the testimonial by a student. You can check more. We are into media also. Okay. And you can check us everywhere. So these are the reviews. You can check us on Google, as I told you, Google, Facebook, Instagram, all the social media you can check. And as I told you, we have the tie-up with the RCM, right? So we have, as you can see, like from Omega, Optum, Gaps, everywhere we'll be like getting the interviews whenever they are openings and all. We prep our students and send them. You can check us into the media also. And this is just like what we have like achieved till now. And it is more than this. And we are still counting. These are our achievements. Okay. So some of you have like placed the questions in the chat box. Before I go ahead, take your questions. Let me answer a couple of questions which are frequently asked by the students. The same thing is being asked there also. So yeah, so here the educational background. Whatever be the educational background, science or the non-science, you're most welcome to like kickstart your career into the healthcare industry. Okay, so get the training done, get certified, and you can go for the jobs. Or without the certification also you can get the jobs. Okay, career gap. Sometimes we do some job and you had a career gap, you are not doing now, or now you want to start again. That's a good decision. Kickstart it. Okay, that's a decision. You want to start your career, you will be like starting as a fresher in medical coding, but whatever career you did before, right, that will add a weightage to your resume. Depending upon the company you're joining, they may or they may not like go ahead with that career, the experience and all. Okay, but you're starting your career into the medical coding as a fresher. Okay, with certification, I told you the highly preferred certifications are both your CPC and CCS. Anything you can take. Life science, non-life science background, anyone can come for the training and go ahead with the training, guys. We just need the bachelor's degree or a diploma equivalent to the bachelor's degree, which will be like helping with the job post and all. And yeah, non-certified, you are not certified, you want to like get certified later, welcome. You can like go ahead. Some companies are hiring the non-certified also, but obviously there will be some conditions, right? You should like get certified in a couple of like months or in a stipulated period and all. So those things will be there depending upon your company. But there are opportunities for non-certified. But the only thing is for certified, it will be a vast number of opportunities with the salary difference and all. For non-certified, it will be less number, but there are opportunities. Okay, the salary will vary a little. And the trainers, I told you, our trainers are professional. They'll teach you in such a way that you clear your certification and plan your career and grow like eventually in your career, upskilling yourself. And jobs in abroad, you need to like dig for the jobs in abroad, or your company may be like suggesting and all wherever you're placed. You need any help for that part, we do the assistance only. Okay, work from home, it purely depends upon the company you're joining or working, guys, and your performance. Yeah. And the discounts I showed you on the like the examinations, the certifications, what we provide to the students. Placements, we do the job assistance. It is you who has to grow out and like go to that company and crack the interview, get the job. Okay, but we groom you in such a way that you build your confidence and crack the interview. So these are the things, like they are the frequently asked questions. Hope I have cleared all your doubts regarding medical coding, the training and the certification and the job assistance and all. And yeah, so these are our numbers. As I told you, we are Hyderabad placed, Amirpet and High Tech City. Whoever wants to like visit our facility, you're most welcome. You can come and meet us there. And yeah, thank you so much for joining on the weekend and looking into the healthcare to build your careers. This is Dr. Pratima signing off to see you all in the classroom.